The next back pain scenario we'll be looking at is an ankylosing spondylitis. Ankylosing spondylitis. In this particular case, you're an FY2 in a GP surgery. So let's put the department here because management will depend on your location. So an FY2 in a GP surgery, and you are, of course, seeing a 33-year-old gentleman who was coming with a back pain. He has had back pain for the last 6 months. The pain is worse in the morning, and he does experience morning stiffness. He works as a bus driver. Okay, so if he does not go to work and lies in bed the whole day, then his pain is worse. Going to work, it does help him, okay, with the back pain, though sometimes after sitting for a long time, while driving, standing up can cause a little bit of stiffness and pain. But walking around does help him with his pain. This is the first time he has been experiencing the pain. So you're going to take the history as usual, as we discussed before, and going through is a pain, the Socrates, going through the differential diagnosis of all the back pain, doing the ICE, the PIMA-FTOSA, the effects of symptoms, and summarizing the main history. And then, of course, performing an examination. The examination we need is spine examination, neurological examination of the lower limbs, and of course, a epirectal examination. In this particular patient, okay, they'll give you the findings that patient has got tenderness on the sacroiliac joint. There is tenderness on the sacroiliac joint, which of course is typical of ankylosing spondylitis. So you're going to have to explain the diagnosis. He has got an ankylosing spondylitis. It's an inflammation. Okay, it's a chronic condition, okay, of the joints, in particular of the spine. Okay, chronic condition or chronic inflammation of the joints of the spine. Okay, and it can cause stiffness, it can cause pain in the back. Okay, good. Now, in terms of management, explain that the diagnosis of an ankylosing spondylitis is difficult and it needs to be referred to the rheumatologist to make it the diagnosis. That there is no one symptom or one investigation that can confirm the diagnosis. So it is looking everything together, looking at his symptoms and also together with the investigations. So today you're going to refer him to a rheumatologist. It's going to be a normal non-agent referral. What you're going to be doing next, we're going to be doing the blood test today. Okay, routine blood test to make sure it's not anemic and check for signs of inflammation. We're also going to be performing a special blood test, which we call HLA-B27. Okay, and because he's in pain, we'll prescribe this particular patient analgesia, in particular non-steroid anti-inflammatory drugs such as ibuprofen. Encourage the patient to keep exercising, and they are not to be, of course, not resting, but exercising will be very crucial. At the moment, this is a suspected diagnosis of an ankylosing spondylitis. So this is why we need him to go to the rheumatologist for confirmation of the diagnosis. This is ankylosing spondylitis. Thank you.